The Romano family are second-generation Canadians whose parents immigrated from Italy. Their socioeconomic status would be described as lower middle class. They are Catholic, quite involved in the Catholic Church community. Dina and Frank Romano have been married for 17 years and have 3 children, David, who's 16, Trevor, who's 14, and Emma, who's 12. Dina has recently returned to work part-time after being a stay-at-home mother. She has also returned to school part-time to complete her degree in human resources that she gave up to raise her children. Frank works full-time as a general laborer in a busy construction company. He's been off work for a month after fracturing his ankle in a fall on a job site. The greatest issue this family has been faced with is Emma's ongoing illness for several months and the eventual diagnosis of Crohn's disease. The impact of this diagnosis has been emotional, psychological, physical, and financial. Emma's health problems began 4 months ago when she started losing weight, had a decreased appetite, became lethargic, complained of abdominal pain, nausea, dehydration. Her bowel movements range from severe constipation to bloody diarrhea stools. Emma's illness has resulted in her missing a significant amount of school, and once diagnosed, she had to start taking medications, one called prednisone to decrease the inflammation caused by Crohn's disease, and then she started on a medication called Remicade that she receives at an infusion center by IV every 4 to 6 weeks based on her symptoms. This medication is quite expensive, and not all of the cost is covered by Frank's insurance. It has been a difficult time for all members of the family to realize that this disease will never get better. It is lifelong. David and Trevor are teenagers quite involved in sports, specifically hockey, which is both expensive and time-consuming. Dina has just started work and school and finds herself quite overwhelmed trying to help Emma cope with her illness and see to the needs of her other children and her husband Frank. Frank has been unable to work due to his injury, which has resulted in a loss of income. He is unable to drive his children to all of their sports practices, to Emma's appointments, and he's worried about his daughter's health.
Good afternoon, Mr. and Mrs. Romano, David, Trevor, and Emma. My name is Gia, and I am a family nurse. Mr. and Mrs. Romano, how would you like me to address you individually?
We are comfortable with being called Frank and Dina instead of Mr. and Mrs. Romano.
That's wonderful. I am meeting with you today to find out what your feelings and concerns are, and also what you would like to get from this meeting, whether it's clarification, information, or anything else that is in your mind. I would like to start with you, Frank. You are currently taking care of an ankle injury which has limited your everyday movement. How does having this injury make you feel?
Well, I cannot drive or work with this injury, which means I can't help my family the way I want to. And it makes me worry about them. I am worried about Emma the most because she really needs me at my best to provide support, and I don't want her to worry about me. I am not bringing in the usual income that I used to, and the bills are starting to pile up. And I can't help with driving everyone around, which is very frustrating for me.
I can understand why you feel that way, Frank. It is tough, especially for someone who is used to being on their feet and on the go. Thank you, Frank. Tina, you are now back to employed work, taking academic courses and taking care of your family at home. How do you feel about handling and doing all these things?
I manage. It does get a little hectic sometimes, but I'm able to work, cook, do laundry, and clean on weekends. I just have less time to spend quality time with my family and do everything else. I fear more for Emma, who may have bad days with her Crohn's and I'm not able to be there for her because I'm at work or academic class. I feel bad about that.
Handling a number of responsibilities can be difficult on some family members, and I can see why you have concerns about Emma's illness when you're not around. Frank's presence at home must bring some relief of that concern for now, but we can look into other ways Emma can have someone at home with her on those days. Thank you, Dina. David, you are doing well in school and your sporting activity. How do you feel about the changes in your family when it comes to health, schedules, and family time?
I worry a lot about Emma. It's hard to see her go through this, and I wish I could help her more. When I'm not in school or hockey practice, I try to get her to do some outdoor things by hanging out at the park, movies, or making sure she gets some rest when she needs it. I have kept my schedule the same, and family time is at dinner time mostly.
Being able to take Emma to the park and making sure she gets needed rest are very thoughtful and caring things to do, David. Thank you. The other athlete in the Romano family, Trevor, you two have been doing well in school and sports. What are your feelings about the changes in your family?
I don't know. I guess I feel scared for Emma, but I keep an eye on her because we go to the same school and some kids like to make fun of her. I am fine, and I'm glad I can still play my favorite sport, which is football. Sometimes I join David and Emma at the park and movies, but I would rather be at home because I never know what to get for Emma to eat.
Some kids can be insensitive, and Emma is fortunate to have you, Trevor, looking out for her. Places like the cinema and park vendors don't really have food that is favorable with Emma's illness, but you, Trevor, are considerate enough to know that. Thank you. Last but not the least, Emma. I can only imagine how having Crohn's disease has changed a lot of things for you. How do you feel about having Crohn's?
I don't like how it makes me feel. I also don't like the medicine, but I have to take it to feel better. I can't play sports or hang out with my friends anymore because my belly hurts most of the time. I'm sad about my swollen face. I don't like eating and I'm getting bigger. Kids at school make fun of me, but Trevor always stops them when he is nearby. I like it when David and I go to the park and the movies too. I feel so much better on those days. My mom makes my meals in the morning before she leaves for work because I can't eat anything I used to eat anymore. Dad keeps me company when I'm at home ever since he hurt his ankle.
The medication does cause changes in the shape of the face and weight of the body, but with time, these changes may go away. You, Emma, have been very brave through all the hospital visits and in taking care of yourself at home and in school. Having brothers like David and Trevor to look out for you. Your mom and dad's support helps you to cope with the illness. There are many ways to make living with Crohn's disease better for the family and also support groups that Emma can join to learn how other children her age have been coping with having Crohn's disease. The family can also explore the provincial government health support plans to see if they qualify for additional medical support for the costly medication Emma is taking.
Therapeutic questions. How might you demonstrate manners to the family? Give specific examples. It is fundamental for the nurse to demonstrate professionalism and friendliness to the members of the family. In the initial, as a stranger, the nurse should initiate a warm and friendly environment in order to gain trust and respect of the family. According to Wright and Leahy, presenting decent and good manners instill trust in the family and help build a trusting relationship with them. Examples of good manners are the following: introducing oneself to the family members. For example, good morning, I am Carlo Cruz. I am a community nurse working with CCAC. Next is explaining the nurse's role and reason for the interaction. For example, I came here today to conduct an interview with each members of your family. I am also hoping to do an initial health assessment for you and your family members. Next is calling the patient and their family members by their name according to their preference. For example, good morning, Mrs. Romano. How are you and the family? Next is asking permissions or consent and explaining any interventions or actions. For example, my plan is to do a health assessment for your family. I am going to start asking some questions regarding your health, and then I'm going to do relevant physical assessment. Would that be fine with you? Last is keeping promises, including being on time and keeping track of the agreed time. For example, if it fits with your schedule, I will come back Thursday next week at 10 a.m. What 5 therapeutic questions would you ask to engage the family in? According to Laforêt-Fleischer and Ford Gilboa, as cited in RNAO, identify 5 broad questions that can be explored with families to assist nurses in implementing a family assessment. These are: first, can you tell me the most difficult problem the family is dealing with at this moment? For this focuses the actual problem which the family determines as the priority. Next is, what do you think are the reasons that might have caused to the family's present health behavior or situation? For this explores the family's perception about the reason for their current situation. Next is, how is the family's response to the issue? For this explores the family's perception about their actions or response to the situation. Next is, what does the family need to achieve in connection to the present issue? For this establishes what goals or outcomes the family expects as a result of their actions. Last, what are the reasons the family utilizing and what different assets could be activated? For this focuses on the family's resources or source of support. What psychosocial considerations are important to examine for your family? What difficulties or challenges may they be facing in this situation? Letter A. Family resiliency. Every family has their own repertoire of coping strategies. Those strategies may or may not enough during stress periods. In the family's case, each member of the family is worried about Emma's health condition. Dina is struggling to meet her commitments at work and school to help Emma cope with her illness. Frank feels like being worthless because he can't fully support the family financially and the boys in their activities. Boys are getting discouraged to play hockey, for they see their parents are being stressed and they won't make it into practice regularly. Letter B. Social support. Emotional support of the whole family to Emma is unparalleled. However, she is experiencing bullying at school from her classmates because of the changes of her appearance that may lead her to isolate herself from people and depression. The family gets spiritual and emotional support from the churchmates. However, they don't get enough support from their relatives, as Dina doesn't want to ask help from her sister, and both Dina and Frank's parents has some health issues and unable to be there for the family. Trevor, although worried about her sister, he often feels that he is forgotten. That may lead her to isolate himself from the family. C. Anxiety. Due to daily stressors and working to help the family identify specific goals to achieve over the next few weeks or months, it is not impossible for the Romano family to experience anxiety. The whole family is worried about Emma's future battle with her disease. Frank and Dina can be worried about the family finances, Emma's medical treatment, and future of the kids. Kids are starting to get worried of their future endeavors because they are not completely motivated in their school and sport activities. The Romano Family Care Plan. Family health problem identified. Subjective. Frank, Dina, David, and Trevor have all stated, "I worry about Emma's health," and Emma has her own anxiety about the sickness. Nursing diagnosis of family health problem. Anxiety related to Emma's Crohn's disease and medication expenses. Nursing intervention. Assist family members with voicing their feelings about their worries. Rationale. Use therapeutic communication. Encourage each member of the family to talk about their worries, and it gives the nurse an opportunity to address them, according to CNO, cited on CNO 2018, page 5. Evaluation. Family express their feelings freely about their family health in a neutral environment, and the goal was met. Resources needed and tools available. Recommendations and locations for discussions. Clinic or home visit, family's choice, that best suits the family's comfort level and support for the discussions, cited on RNAO 2002, page 30. Next health problem identified is objective: concern for financial burdens from household to healthcare costs and caregiver burnout. Nursing diagnosis of family health problem is anxiety related to reduced family income from Frank's inability to work because of injury. Nursing intervention. Direct the family to recognize methods of dealing with feelings of anxiety, cited on Vera 2013. Rationale. Assist the family members with adopting helpful coping strategies for identified feelings of anxiety, cited on CNO 2018, page 6. Evaluation. Obtain help from anxiety triggers like family financial struggles, Frank's temporary disability, lack of help from extended family or friends, this goal not met. Resources needed, tools available. Community-based systems referral to social worker or counseling as a family or individually. Assistance from church members. Cited on RNAO 2002, page 26 to 27. The next family health problem identified is family members are worried about Emma's health and care. Nursing diagnosis of family health problem. Anxiety related to family's limited knowledge on Crohn's disease and how to support someone with the condition. Cited on Wayne 2016. Nursing intervention. Encourage the family to utilize the supports and system information presented by the nurse. Cited on Vera 2013. Rationale. Provides answers to the concerns of limited knowledge and patient teaching on Crohn's disease care at home. Share resources that are community-based or available online for additional support and education. Evaluation. Family has less anxiety and more knowledge about Crohn's disease and living with it. Goal met. Resources needed and tools available. Crohn's and Colitis Canada website for additional supporting information. Crohn's and Colitis 2016.